To go deeper, to have more understanding about anatomy of the valves, we should understand a very important principle when we talk about the heart valves. All the valves are at the same level in the heart, as you can see. So this is the mitral valve, and this is the tricuspid. So they are the valves connecting uh, blood and conducting the blood between atria and ventricles. And this is the aortic valve, and this is the pulmonary valve as well. So, first point, notice that the only bicuspid valve is the mitral valve, and all the other valves are tricuspid, so they have three cusps. So, tricuspid have three cusps, aorta, and pulmonary as well. And we have a disease called the bicuspid aortic valve. So all the valves are tricuspid except the mitral, which is bicuspid. All the valves are at the same level in the heart, as you can see. So, and as you can see here, they are at the same level as the heart because all the valves are in a fibrous ring separating the atria and the ventricle called the annulus fibrosus. And the only connection between atria and ventricle through the annulus fibrosus is the AV node and AV bundle. So there is no direct muscular connection. And this complete isolation between the muscles of the atria and the muscles of the ventricles makes the excitation and the contraction of the atria is completely separate from the excitation and contraction of the ventricles. This usually helps us to understand some types of murmur, like what we call Austin Flint murmur, which is a type of Austin Flint murmur, which is a type of functional murmur, happens usually in case of aortic regurg, when the blood returns during the diastole through the aorta. And return of blood elevates the cusp of the mitral. And you ask yourself how return of blood will elevate the cusp of the mitral valve. You will not understand it except if you know that all the valves are at the same level in the annulus fibrosus. So return of blood functionally can elevate the cusp, inducing a murmur like the murmur of mitral stenosis, which is a functional murmur, not organic one.